How's it going, guys? Medium difficult question, ophthalmology, step one, internal medicine, TCK. Before we get started, please subscribe to my channel. I really appreciate it. Give it a like, really appreciate it. Find me on Instagram, Mehlman_medical, Mehlman_medical. Links down below for me, Telegram. Links to the Telegram group and channel down below. And I start the clip. 64-year-old man, fundoscopic examination performed, blood pressure 170/100, diabetes, type 2, managed with metformin, glyburide. Which of the following most likely explanation for the patient's findings? Let's just hop to the answers. Choice A, central retinal artery occlusion, correct answer. So we're looking at a very buzzy cherry red spot on the macula here. Patient's going to have presumably hypertension causing carotid stenosis, so atheromata of the carotid arteries, cholesterol plaque that's launched off to the eye. Likewise, we could have given you atrial fibrillation where a patient has a left atrial mural thrombus that's launched off to the eye. So we're going to lose most of the blood flow to the retina, but the choroidal artery can still supply the retina, which is why we get the cherry red spot. And then you can be aware peripherally of lower yield things, e.g. for pediatrics, Niemann-Pick disease, Tay-Sachs, which also present as a cherry red spot on the macula. So patient's going to have what's described as a curtain coming down. That's how they can describe it, the loss of vision. And they want ocular massage as the first treatment because sometimes you can actually move the embolus into a more distal portion of a vessel and help mitigate some of the loss of vision. Let's just hop to the other answers here. Choice B, central retinal vein occlusion, wrong fucking answer. I think I've only seen this once on a TCK form. So very low yield. This is going to be hypertension, diabetes as risk factors, and the fundoscopy will show you tortuous and congested retinal veins where the entire fundoscopy looks violaceous. Wrong fucking answer. Choice C, diabetic retinopathy, wrong fucking answer. You're going to see three things on the fundoscopy. Number one, hemorrhages, which we don't see here. Number two, soft exudates, aka cotton wool spots, which are axoplasmic material from neuronal degradation. And number three, hard exudates, which are lipoproteinaceous deposits from leaky microretinal vessels. Wrong fucking answer. Choice D, actually real quick, diabetic retinopathy you can be aware is dry or wet. Dry means you do not have neovascularization. Wet means you do, where there's new vessels that form. And you can give anti-VEGF treatments for the latter. As I already said, wrong fucking answer. Choice D, hypertensive retinopathy, wrong fucking answer. So similar to diabetes, you can get cotton wool spots, soft exudates, as well as hard exudates. But you're going to get two findings that you're not going to get in diabetes usually, okay? So number one, flame hemorrhages. Now, you can see hemorrhages in diabetic retinopathy, as I just talked about, but the adjective flame, when you read a vignette, you don't have to be able to identify these things in a fundoscopy, but flame hemorrhages, if you see that in a vignette, it's very buzzy for hypertensive retinopathy. The second is going to be AV nicking, arterial venous nicking. Once again, you don't have to be able to identify it visually, but if you just get a big fucking paragraph about some eye condition, you're not sure what's going on, and you see somewhere in there AV nicking or flame hemorrhages, you know right away they're talking about hypertensive retinopathy. Wrong fucking answer. Choice C, macular degeneration, wrong fucking answer. So this is going to present with drusen on the retina. So drusen, large yellow blocky deposits, which similar to hard exudates are lipoproteinaceous. You say, well, what's the difference? It's that drusen is described in macular degeneration. If you say the word drusen, people think you're going to be talking about macular degeneration, whereas hard exudates are less specific and they tend to be diabetes and hypertension. But they're just both lipoproteinaceous deposits. Macular degeneration, similar to diabetic, it can be dry or wet with neovascularization, where you can use anti-VEGF treatments. And the highest yield thing for macular degeneration, apart from the elephant in the room, obvious point being that you're going to lose your central vision, which is the macula. The most important point for USMLE is that macular degeneration presents with a wavy line test. So when you do an Amsler grid test, which is going to be looking at straight and horizontal lines, they're going to appear wavy in macular degeneration. Might sound weird, don't really know what to tell you. It's on the NBME exam. Wrong fucking answer. You know the deal. I'm seeing make more content. I feel like I can subscribe my channel. Appreciate your time. That's it.